Next, we'll move into how to perform an examination of dynamic anticipatory balance. So again, when you're looking at testing dynamic anticipatory balance, you're looking to see how the patient does maintaining their balance during self-generated movements. So the patient will be moving, it might be their head and neck, their trunk, their upper extremities, their lower extremities, and you're going to assess how they perform those movements and maintain their balance. You'll select any functional developmental position that has relevance for the patient, where the patient is struggling or has suspected impairment in. Again, you'll make sure that your patient is well aligned before beginning the actual test. For dynamic anticipatory balance, you're going to start with the patient moving their own head and neck. So once they're in their position, you'll have them flex their head forward, extend, rotate to either side, and laterally flex to either side. From there, you'll move into trunk movements. So again, you'll repeat that process. You're looking at trunk flexion, extension, rotation, and lateral side bending to both sides. Once the patient's completed that, you'll move into upper extremity self-initiated movement. So you're going to have them reach. And you're going to have them reach to a variety of directions with both hands in a variety of planes of movement that are functional. We'll talk about in class how you might go about this. You may use a clock analogy for some individuals. You may use targets around the room. For example, reach towards the orange ball, reach towards the door. You may use targets on the floor for when we're doing the lower extremity reaching. It really depends on that patient's ability to perform the assessment with those specific instructions. You're going to have your patient reach to and through their base of support. So they'll reach to the object or the target and come back to the middle, and then they're going to reach through their base of support, because we're really interested to see what their excursion of movement is within their base of support and how they're able to maintain their balance throughout that process. When you do the lower extremity reaching, you have a couple options here. If you're having your patient reach towards the target, you can have them hover over the target, and you'll see that in the video, or you could have their toe lightly touch down on the target and then come back to midline. It's really important, though, that you don't allow them to completely reorganize their base of support by transferring weight through the toe or foot in that activity. And that will be demonstrated in the video clips to come. Okay, Lisa, so the next balance test that we're going to take a look at is called anticipatory balance. And we're going to do this in standing when I say. And really what we're going to be looking at here is the ability for you to generate your own movements and how that impacts your balance. So you had told me that while you're putting away groceries or you're putting away dishes and you're reaching forward and you're moving through your base of support, that sometimes you feel unstable. So we'll take a look and we'll do some different activities that will give us information pertaining to that. Okay? Is it okay if we proceed with that? Mm-hmm. Okay. So the first part of this test is just going to involve you standing up, and we're going to start moving your head and neck. We're going to be looking down, up, side to side, and then also bending so that your ear is approaching your shoulder. Okay? We'll repeat those same motions, but using the rest of your body segments, your trunk here, to complete that movement. Okay? If you have any questions or you're uncomfortable during the test, let me know and we can stop and take a break. Okay? All right, so let's go ahead and stand up. We'll take just a step or so away. And your feet are going to be shoulder width apart and your arms are just resting by your side. Okay, so what I want you to do is look down towards the ground and then come back to the middle, and then look up at the ceiling and come back to the middle. Now you're going to turn so that you're looking over your right shoulder and come back to the middle and then towards me. Good. Okay, and I'm going to have you do that one more time. I want you to be mindful that I don't want your trunk to be turning with that motion. The motion is really just coming from your head and neck. Good, and come back and to the other side. Good. Okay, so now the next one, side bending. So you're going to take your right ear and bring it towards your right shoulder, but it's okay if it doesn't touch. And then come back, and then to the other side. Great. How do you feel? Okay. You need a break?
Nope.
Okay, so we'll continue to move forward. So for the next, you're going to bring your hands forward so that you're coming close to the ground, like you're going to touch the ground. Good. And come up. And now you're going to bend backwards. And come back up. Okay. You're going to turn your whole body segment, your whole trunk here, over this way so that you're looking over your right shoulder. And come back to the middle. And now the same thing towards me. And come back to the middle. For this one, for the side bending, you're going to take your right hand and point your fingertips towards the ground as you move towards the floor. Good. And come back up. And then towards me. And come back up. Okay. Why don't you go ahead and have a seat, and I'll explain the next piece. How are you feeling? Okay. So we've done some movements with your head and neck and your trunk, and now we're going to look at your arms. Okay. So the next part of the test is going to involve you standing, and we'll use a clock analogy. And you're going to be reaching towards targets, imaginary targets set up as the shape of a clock. So if I have you, if I say reach to 12 o'clock with your right arm, where would you reach? Good. So we're going to be reaching to that target, and then you're going to come back and rest, and then you're going to be reaching through. So really what I'm looking to see is how do you do with a movement that you've created throughout your entire base of support without actually taking a step or readjusting your feet. Okay? Okay. Is it okay if we continue with the test? Mm-hmm. Okay. So when you're ready, I want you to stand up and just take a couple steps forward. Okay. Okay, Lisa, so just to reiterate, we're going to start with your right arm, okay? And we're going to be using a clock analogy. The clock is on the floor and you're standing in the center of the clock. Okay. Okay. For each direction I call, you're going to reach both to, and then we'll come back to the middle and reach through. Okay. We're going to be reaching high, middle, and low. Okay. Okay, because we want to cover a variety of trajectories that would be functional in your everyday life. Okay. Okay. Questions?
I don't think so.
Okay, so let's stand shoulder width apart. So just move out just a smidge. Okay. All right, so you're going to use your right arm, and you're going to reach to 12 o'clock, and then come back, and then reach through. Good, and come back. And let's try 2 o'clock. 2, come back, and then all the way through without taking a step or lifting your foot. Good. Okay. Can you reach to 3 o'clock? And come back, and then through. Good. Okay, and then we're going to reach a little bit behind you, so think about 5 o'clock. And then through. Good. And then one more right directly behind you, so 6-ish or so. And then through. Okay. And then now you're going to reach this arm across the middle of your body, so you're thinking about reaching towards like 10 o'clock, 11 o'clock. And then come back, and then through. Good. And then can you do one more, maybe like around 10 or 9? And then through. Good. Okay. How you feeling?
Good.
Okay. So what we would do then is repeat the same process. So we did the middle of the range. We also want to look at high and then low. So let's do a couple repetitions of that. So we'll start again at 12 o'clock, and this will be a high 12. Come back, and then through a high 12. Good. And then we would repeat that as well low. So we'll show a repetition of that. So we'll reach low 12, 2, good, and then through. Good. And then we would continue to repeat the rest of that. So the next part of the anticipatory balance assessment involves using your legs. So I'm going to demonstrate what I'd like you to do once we stand up. Basically, you're going to be reaching towards those targets, and it's the same strategy that we used for your arms. So you're going to be reaching to that target and then come back to the middle, and then reaching past that target with your leg, and then come back and rest in the middle, okay? Options here are you can either just hover above the object and not actually touch your foot down and then come back, or you can lightly touch your toe down, but it's important that you don't transfer any weight through your foot, so it's just like a toe touch, like you had something like an egg underneath your toe that you didn't want to break. Okay. I'm going to do a demonstration so that you're clear on what the test involves. Okay, so we'll do 1 foot at a time. So you're going to come towards the object, to the object, and then back and reorganize your base of support. And then you're going to go through and come back. Okay? Same thing, we're going to repeat towards all the targets. Okay, so you would make your way around, eventually getting back right behind you. Okay? Questions on any of that? I don't think so. Okay, so you don't need to turn around like I did. I was just trying to demonstrate that for you. So you can stand up and then go towards the middle of those targets. Okay. So you're going to be transferring your weight onto your left leg, and your pointing leg will be your right. Okay. So whenever you're ready, you can make your way around. So hover and come back, and now you're going to go through. Good. Same thing with that target. Okay, and I'll have you repeat that one because a little bit more weight went through that than what I had. And that target may be a little far, so if it is for the length of your leg, just go as far as you're able to. Good. And then the one back there. Good. Good. Okay, thanks. Okay, Nolan, we're going to start with the movements of your head. So you go ahead and look down towards your toes and look up towards the ceiling. Good, and then straight ahead. Okay, now turn and look over the shoulder. Good, and then turn and look towards me. Hi, and come back to the middle. Now bring this ear to this shoulder, but it's okay if it doesn't touch. Okay, try that one more time. Okay, good. Now bring this ear to this shoulder and keep this shoulder nice and straight. And come back to the middle and try one more time. This ear to this shoulder. Perfect. And come back to the middle. Okay. Now we're going to bend down forward and try and touch your toes or come towards the ground with your hands. All the way. But keep your legs nice and straight. Here, start back up at the top. Like this. Perfect. And come back up. Now you're going to look back with your whole back. Nice job. And come back up. Okay. Now I want you to just slide your hand down your leg. Good, buddy. And come back up. And do that same thing with the other side. Good. Now go ahead and cross your arms. And what I want you to do is turn your whole body to look over your shoulder. Good. And come back to the middle. Turn your whole body to look the other way. Good. Okay, come back to the middle. We'll try that one more time because I want your feet to stay right where they're supposed to be, right there. So cross your arms again, and then look that way over your shoulder. Turn, turn, turn. Keep turning. Good job, and come back to the middle. That was perfect. Okay, go ahead and rest your arms. Now we're going to reach with your hands, okay? So I'm going to pick an object in the room, and I want you to reach towards it, okay? All right. So let's start with your left arm. Can you reach towards that orange ball for me? Good, and come back. We're going to keep your feet right where they're supposed to be, right? Let's back up a little bit. Right there, okay? So reach towards the orange ball and come back. Now reach a little bit further. Good, and come back. Reach towards your mama with this arm. And now reach a little further for her. Good, and come back. Okay, see that white ball over there? Can you reach towards that? And then reach a little bit further. Good, and come back. Okay. All right, now we're going to take this arm and you're going to reach over towards that mat. See the red and blue mat? And reach. And I'll come back to the middle. And reach a little bit further. Good. And try and keep your feet nice and still. Now you're going to turn around and reach. See that blue bolster? That blue tower on the cabinet? You're going to reach towards that. And a little bit further. Good. All right, come back to the middle. We would repeat that with the right upper extremity as well, reaching towards a variety of targets, both crossing in front, crossing midline, turning and reaching behind of the patient. Go ahead and take a seat, buddy. You can pause it, Lisa. Test. See these targets I put down, all these different color targets? You're going to stand on your left foot and you're going to reach towards the green one. Don't touch it, just reach towards it and then come back. Good, and come back to the middle. Now you're going to reach towards the yellow and come back. Reach towards the blue, come back. Reach towards the orange. Whoa, I gotcha. And come back. And the red, and come back. Good. And we could repeat this by moving these targets out a little further. Other options here are to put your toe down and then come back, but you don't want to transfer any weight through the front foot. So you can hover, or you would be able to touch your toe down and come back. And we could slide these targets out a little bit further so that he had to reach to the end of his limits. Okay, thank you. Next, we'll talk about how to perform an examination of dynamic reactive balance. When you test dynamic reactive balance, you're testing your patient's ability to maintain their balance when they're externally challenged. So when you're assessing this, that external stimulus will come in the form of your hands on the patient providing a perturbation. You're going to select a position that is functionally relevant for that patient. It may be sitting, it may be standing, and you are going to have them well aligned before you begin the test in the position that you've selected. From there, you're going to provide perturbations to the patient in all directions. So you want to make sure that you've assessed the patient's ability to respond to anterior and posterior perturbations, medial, lateral, and then on each of those diagonals. And you'll examine their response to the perturbation. You want to start with slow perturbation, so small amplitudes, less force, and then build as the patient can tolerate. Where you put your hands on your patient for the perturbation will really vary based on that patient's functional presentation, your size compared to your patient's size, the position that you're going to test that patient in. It really can vary, and you could have a rationale for a number of positions that you've chosen. But what's really important, no matter where you have your hands to provide that perturbation, is that you don't limit the patient's natural balance reactions with your hands. So if your hands are up proximal near the shoulders and you're limiting their arm from coming out for a protective extension or equilibrium reaction, then that's going to impede their balance. So you need to select a location that won't limit your patient's natural balance response. The other piece that you need to consider with hand selection is that you really want to catch your patient kind of off guard. If they see the perturbation coming, then they're going to have an opportunity to ready their postural response system, their postural control system. And then that can give you some false information pertaining to their balance system. The movement may not be as fluid or natural because they may have assumed a stiff position to kind of ready their response system. So you want to kind of create the element of surprise when performing your perturbations. You may be standing behind your patient. It could be posterior laterally, so kind of on a diagonal. You might have a rationale for why you are lateral to your patient, but you need to apply the perturbation in a way that creates an element of surprise, yet you also still need to appropriately guard your patient and maintain their safety. The next test we're going to do is an assessment of dynamic reactive balance in standing. Okay, Giada, this is the last of our balance tests for today. What we're going to do is we're going to stand up on this mat when I tell you, okay? And the reason we're doing this test is because when you're in school, you're in the cafeteria, if somebody gives you a little bump or a shove, or you run into somebody in the hallway, sometimes that causes you to lose your balance. So we're going to do a test that involves me putting my hands probably right here, and we're going to see if I can figure out why that's happening to you, if you're getting a little, when you're losing your balance in school in those situations. Okay? All right, so go ahead and stand up, and can you turn and face? Good. Okay, go ahead and have a seat. So I didn't want to tell Giada exactly what I was going to do because I needed her to be not expecting and not anticipating her balance response, because that can really change the way your postural control system readies itself for that stimulus. So we wanted to see kind of a natural response. So you would start your perturbations off low intensity and then build in intensity. In class, we'll talk about what are typical stepping strategies, what would you expect to see, and what wouldn't you expect to see. I chose the blue mat here so that she would be most safe because it is softer than falling on this floor. The one thing you need to keep in mind is that any mat that you pick, you want to pick a mat that doesn't have a lot of compliance to it, because we're not testing her static balance. We want to see how she reacts to an external force for perturbations for dynamic reactive balance. So just something to keep in mind. If you do choose a mat, choose one that doesn't have a lot of give to it, because we don't want that to influence the results of your balance assessment. There are other places that you can put your hands and other locations that you might stand. We'll talk about that in class, and that's really driven based on your height, your morphology to your patients, and kind of what their presentation is. So if you have a patient who tends to lose their balance to the right, maybe you stand on that side as opposed to being directly posterior, or maybe you're on an angle. So you really need to modify any of these assessments based on your patient's functional presentation. And that concludes the 3 types of balance assessments that we'll go over in detail, and that you'll practice on lots of different bodies while we're in class. Thanks for coming in, Giada. Bye. What are you going to say? Bye. You're going to say that's a wrap? That's all right.